Okay, let's unpack this. We're diving deep today into a topic that's, well, absolutely critical for anyone involved in equine breeding: understanding pregnancy loss in mares. Now, when you think about abortion in horses, maybe the first thing that springs to mind is an infectious disease, right? Like EHV1.
That's certainly a common concern, yeah.
Yeah,
And infectious causes are serious, no doubt about it.
but our stack of sources, including some really expert insights from materials like Equine non-infectious abortion, causes and management, reveals something truly surprising and honestly incredibly important.
Yeah.
A vast majority of abortions, according to this research, somewhere between 85 and even, get this, 95%, they aren't actually due to infections at all. They're non-infectious.
Wow, that's a staggering statistic. It really flips the script on where we often focus our attention, doesn't it?
Exactly.
It highlights this whole hidden world of other reasons why a mare might lose a pregnancy.
It does, and that's our mission today, to explore this diverse world of non-infectious causes. We'll look at, what they are, how they happen.
The detective work involved.
Yeah, the detective work needed to figure out the culprit, and crucially, what you can actually do about them, how to manage the risks, and hopefully prevent these heartbreaking losses.
So think of this as your shortcut to understanding the often overlooked side of equine abortion.
Exactly. It's about broadening our perspective beyond just chasing down bugs.
Makes sense.
So let's start simple. What are we actually defining as an abortion in this context, just so we're all on the same page?
Okay. Based on the material we've got, we're talking about pregnancy loss that happens generally between about day 40 of gestation.
Which is when you can usually see the fetus on ultrasound.
Right, precisely.
Yeah.
From that point all the way up to roughly term, which is around 320 days in mares,
Yeah,
and it results in, well, the expulsion of a non-viable fetus.
got it. And you hammered home that statistic, 85 to 95% non-infectious. Why does understanding that specific number change things so much?
Well, it changes pretty much everything from a diagnostic standpoint.
Mhm.
Because if you're only testing for infectious agents after a loss happens,
You're missing most of the potential causes.
exactly, you're going to miss a diagnosis in the vast majority of cases.
Mm.
So understanding this whole non-infectious landscape is absolutely essential for getting an accurate diagnosis.
Which then lets you manage it properly.
Right. It allows you to implement targeted management and prevention strategies that actually work for that specific problem, whatever it turns out to be.
Okay, that makes perfect sense. You can't fix what you don't understand. So, generally speaking, what are the different ways these non-infectious issues cause a pregnancy to fail? What are the underlying mechanisms?
Well, the sources show the problem can originate from sort of three main places. It could be an issue with the mare herself, or something inherently wrong with the developing fetus, or even factors in the external environment.
Okay.
But ultimately, they often lead to fetal death by compromising the placenta, meaning it just can't support the fetus adequately.
Like it fails somehow.
Yeah, placental insufficiency is a big one. Or it could be through inherent problems with the fetus, like, say, genetic defects or sometimes even physical trauma.
It sounds like a complex interplay of potential issues then. Let's dive into some of the specific non-infectious causes highlighted in the sources. Where should we start? What's the big one?
We should definitely start with the most common one identified in the literatures: twinning.
Ah, twinning. Yes. The bane of many breeders' existence, I hear. Why is twinning such a huge problem in horses specifically?
Well, unlike some other species, mares are really designed to carry just one foal at a time. They're what we call monodicous. Their uterus simply isn't built, physiologically, to provide adequate support and nutrition for two conceptuses growing to full size.
So the physical space and the resources, they just aren't set up for a double load.
Exactly. The core issue, the fundamental problem, is placental insufficiency. You see, the mare's placenta is spread out diffusely across the uterine lining. With twins, the two placentas have to share that available surface area.
Okay.
And where those two placentas actually touch or butt against each other, the placental surface becomes non-functional, or avillous is the technical term.
Like having two large territories that share a border where, I don't know, nothing can grow.
That's actually a really good way to put it. Those non-functional areas mean there just isn't enough effective surface area left on the rest of the placenta for adequate nutrient and oxygen exchange to get to both fetuses.
So they compete.
They end up competing. And this competition and the resulting stress can also lead to hormonal imbalances. One or both fetuses become growth retarded, and eventually, one or both often die.
And when does this typically lead to abortion? Is it early on or?
The sources indicate twinning abortions are most common in late gestation, often somewhere between 7 and 9 months. But honestly, they can happen at pretty much any stage.
And even if they make it.
Yeah, even if twin pregnancies somehow go to term, the foals are usually smaller, weaker, and have a much, much lower survival rate than singletons. It's just a really tough situation all around.
Definitely a high-stakes situation from the start.
Yeah.
Okay, what's another significant non-infectious cause we should talk about?
Umbilical cord abnormalities are another key player mentioned frequently.
Like problems with the cord itself, the lifeline.
Precisely. This could be a cord that's abnormally long. The sources mention over 90 centimeters is often considered too long or maybe too short. Or, and this seems more common based on the descriptions, excessive twisting.
Twisting? How much twisting?
More than about 360 degrees, like a full twist or more. Or sometimes the cord gets wrapped tightly around one of the fetal limbs.
And that sounds like it just cuts off the supply line, doesn't it?
It absolutely does.
Yeah.
The twisting or the wrapping essentially pinches or occludes the umbilical vessels, the arteries and vein in the cord, and that cuts off the blood supply and, critically, the oxygen to the fetus.
Simple mechanics, but devastating results. When does this tend to happen?
This is usually seen leading to abortion in mid to late gestation, typically somewhere between 5 and 9 months, according to the reports. Often the aborted fetus actually looks relatively fresh, not very decomposed.
Oh, interesting.
Yeah, and you can often clearly see the excessive twisting or maybe discoloration and constriction where the cord was wrapped.
Okay, moving on. The sources mention placental insufficiency again, but this time as a primary issue, not necessarily linked just to twins.
Right, exactly. This is about the placenta simply not functioning properly,
Yeah.
maybe due to other underlying reasons, even when there's no infection and only one fetus.
And under this umbrella, there's that term breeders really dread, premature placental separation. The red bag delivery.
Oh, yes.
Yeah.
That is absolutely a true veterinary emergency. It's one of the few situations where immediate action by the owner or handler right then and there is absolutely crucial.
So what's happening? Why is it red?
It happens when the outer layer of the placenta, the chorion, which is normally attached to the mare's uterine lining, pulls away from that lining prematurely during the birthing process.
So the placenta detaches way too soon. Inside.
Yes, but specifically, the thick, red, velvety side of the placenta, the chorion, often stays attached deeper inside but separates from the foal at the cervix and presents first. This completely severs the oxygen and nutrient supply before the foal is delivered and can take its first breath.
And the visual cue is pretty unmistakable then. You actually see this red bag.
It is unmistakable. You see this thick, red, velvety membrane appearing at the vulva, sometimes even before you see the foal's feet. If you see that, the sources are clear. You have to act immediately. You need to rupture that membrane and help deliver the foal very quickly, or the foal will die from lack of oxygen from anoxia.
Wow. That sounds incredibly stressful. What's the typical timing for something like that?
This occurs in late gestation or right at term. Actually, during the foaling process itself, it's a crisis of delivery.
Okay. What about something called adventitious placentation? That sounds a bit more technical.
It is a bit more subtle, yeah. It refers to a problem with how the placenta actually attaches and develops against the uterine lining. Instead of the nutrient-absorbing structures, these tiny finger-like projections called villi, distributing nice and evenly.
They grow weirdly.
Kind of. They might form abnormally, or only in patches. And this is often linked to chronic underlying uterine issues in the mare herself. Things like endometrial fibrosis, which is basically scar tissue in the uterine lining, or sometimes large lymphatic cysts within the lining.
So if the uterine lining isn't healthy, the placenta can't hook up correctly everywhere.
That's the gist of it. The areas where the placenta is abnormal or simply can't attach properly become functionally compromised or even useless, leading to an overall reduction in the nutrient and oxygen supply for the fetus. It's another form of placental insufficiency.
Got it. We also have an environmental toxin on the list, equine endophyte-infected fescue toxicity. This is about grass, right? Fescue grass.
It is, yes. Tall fescue is a very common pasture grass, but sometimes it gets infected with a specific fungus that lives inside the plant. It's an endophyte called Neodypodium coenophyalum.
And this fungus is the problem.
Well, the fungus itself isn't the direct issue, but it produces harmful chemicals called ergot alkaloids. And when the mare eats this infected grass, she ingests these alkaloids.
And those specific chemicals target the pregnancy.
They do, especially late in gestation. The ergot alkaloids act as dopamine agonists, essentially mimicking dopamine in the mare's body. And one critical effect of that is suppressing a hormone called prolactin.
Prolactin.
Yeah.
Isn't that important for milk production?
Exactly. Prolactin is essential for the normal development of the mammary glands, especially in late pregnancy, and it also plays a role in the proper maturation of the placenta itself in the last couple of months.
So suppressing prolactin, what does that look like in a pregnant mare? What are the signs?
It leads to a whole constellation of problems, primarily showing up in the last 60 to 90 days of gestation. Mares might have prolonged gestation, meaning they go significantly past their expected due date. They often have agalactia,
No milk.
right, complete or partial failure to produce milk. The foals, even if they're carried to term, can be dismature, sort of underdeveloped and weak. The placentas themselves are often described as thickened, maybe edematous or waterlogged, and they're frequently retained after foaling, which is another problem.
Any other effects?
Yeah, there's also a higher risk of dystocia, or difficult birth. Now, while abortion can occur due to fescue toxicity, it seems more common, based on the sources, to see these other complications around the time of foaling.
It's amazing how a tiny fungus hiding in grass can cause such a specific and wide range of problems. Okay, what about issues originating from the fetus itself?
Right, that covers fetal abnormalities. And this category includes a couple of main things. First, congenital anomalies.
Meaning birth defects.
Essentially, yes.
Yeah.
Significant physical defects or developmental errors that are just incompatible with life. Things like severe brain malformations like hydrocephalus or an anencephaly, or major heart defects, severe limb deformities, things like that.
In the other category.
Chromosomal abnormalities. These are errors in the number or structure of the chromosomes which carry the genetic blueprint. Things like having an extra chromosome or missing one. Aneuploidy is the term.
And both of these basically mean the fetus just can't develop properly.
Exactly. They lead to severe developmental problems and ultimately fetal death and expulsion. The timing of the loss can be variable. Chromosomal issues often cause very early loss, sometimes even before the pregnancy is confirmed clinically. Congenital anomalies can result in loss at various stages, depending on the specific defect.
We touched on the mare's overall health briefly before. The sources list some specific non-infectious maternal illnesses that can trigger abortion.
Yes, absolutely. Any really severe systemic illness in the mare can potentially put the pregnancy at risk. Her body is under immense stress.
Like a serious case of colic, that seems like it would be hugely stressful.
That's a prime example, yes. Any severe prolonged abdominal crisis, like a bad impaction that requires surgery, or a twist, a volvulus, or maybe widespread infection in the abdomen, peritonitis is incredibly stressful and physiologically damaging to the mare.
And that stress impacts the pregnancy. How?
Well, the combination of pain, the stress hormones, potential endotoxemia if bacteria are involved, dehydration, poor circulation,
Yeah.
all of that can severely compromise blood flow to the uterus and the placenta.
Cutting off that vital supply line to the fetus again.
Right. It leads to fetal hypoxia, lack of oxygen, and potentially death. The sources also mentioned that while it might be less likely to be the sole cause, severe or prolonged stress from other things like a major injury or maybe very stressful long-distance transport in a particularly sensitive mare could potentially contribute.
So it's not just colic.
No, other underlying maternal conditions can also be contributing factors. Things like equine metabolic syndrome, EMS, or insulin resistance, IR, also PPID, which people often call equine Cushing's disease, severe malnutrition, particularly deficiencies like selenium has been implicated, even things like severe laminitis or significant chronic uterine inflammation or scarring, those lymphatic cysts we mentioned. Even the mare herself having certain chromosomal abnormalities can sometimes play a role.
So the mare's overall health, her metabolic status, even pre-existing conditions, they all play a pretty significant role in maintaining the pregnancy. Are there other non-infectious causes that maybe don't quite fit these main categories we've discussed?
There are a few others mentioned, yeah. One is something called body pregnancy.
Body pregnancy? What's that?
It's where the embryo implants in the main body of the uterus, rather than settling nicely into one of the uterine horns. Because the mare's uterus is shaped kind of like a Y.
Right, the horns and the body.
Exactly. Implanting in the body part limits how much the placenta can properly expand out into the horns as the fetus grows.
Ah, so again, it comes back to not enough functional surface area for the placenta.
Exactly. It leads to placental insufficiency later in gestation. This often results in a late gestation abortion, or sometimes a small, weak foal being born, if it makes it to term.
Interesting. What else?
Another one mentioned is mare reproductive loss syndrome, or MRLS.
MRLS, wasn't that linked to those fuzzy caterpillars a while back, eastern tent caterpillars?
Yes, that's the one. It's strongly associated with exposure to eastern tent caterpillars. Now, while MRLS often involves a secondary bacterial infection getting into the mix,
The initial trigger isn't an infection?
right, the initial trigger is thought to be non-infectious. The idea is that the tummy hairs, the setae, on the caterpillars, cause microscopic trauma or punctures in the mare's digestive tract when she eats them, maybe accidentally with grass. This allows bacteria or toxins from the gut to enter her bloodstream.
And travel to the uterus.
Exactly. They can then spread to the placenta and the fetus, causing inflammation and damage.
And that can cause problems throughout the pregnancy, early on, later.
Yes, MRLS has been linked to both early fetal loss, sometimes quite early, and also late-term abortions.
What about other environmental things? Or maybe even human-introduced factors, medications?
Yeah, the sources use the term xenobiotics, which is basically a broad term for external chemicals or substances that can harm the pregnancy. Besides the fescue alkaloids we talked about, this could include other plant toxins or environmental contaminants. Also, some specific medications need caution during pregnancy.
Like what?
Certain treatments used for EPM, for example, are mentioned as potentially risky. Repeated high doses of certain types of corticosteroids, especially late in gestation, could also pose a risk. There are even some anecdotal reports linking high levels of phytoestrogens, plant-based estrogens, found in some feeds like certain clovers to early pregnancy issues, though that seems less well-defined.
And sometimes, unfortunately, procedures intended to help can cause problems if the mare's pregnancy status isn't known or if something goes wrong.
Yes, sadly.
All right.
These are called iatrogenic causes, basically, problems caused inadvertently by medical intervention. The most obvious example is intentionally using a drug like prostaglandin F2 alpha, which is specifically designed to terminate a pregnancy if needed.
But accidental causes, too.
Right. Things like performing uterine infusions, maybe flushing the uterus, or even taking uterine samples like a cytology or biopsy from a mare who is unknowingly pregnant. That can obviously disrupt the pregnancy.
Wow. Okay. That covers a truly vast spectrum of potential problems, doesn't it? So, with all these possibilities floating around, how do you actually figure out which non-infectious cause was responsible after an abortion happens? That sounds like the million-dollar question.
It absolutely is. Diagnosis is the critical next step for future prevention. But you're right, it's often like being a detective working with very limited, sometimes confusing clues.
Are there often signs before the abortion actually happens? Any warnings?
Not usually, and that's a huge part of the challenge. The clinical signs, if any, are highly variable. Often, honestly, the very first indication that anything was wrong is finding the aborted fetus in membranes.
So no warning at all.
Sometimes there might be subtle signs, maybe premature udder development or some vulvar discharge, although those can also point towards an infection like placentitis or maybe fescue toxicity. The red bag we discussed is the big exception. That's a very clear, dramatic signal right during labor.
And maybe more signs later in pregnancy.
Abortions happening in the second half of pregnancy are perhaps more likely to show some preceding signs, but even then, it's really inconsistent. And very early losses, especially those before day 40 or 50, can easily happen completely unobserved. The mare might just come back into heat.
And even with a full investigation, how successful are vets usually at getting a definitive answer? What's the diagnosis rate like?
Well, the sources report that the overall definitive diagnosis rate for all causes of equine abortion, infectious and non-infectious combined, is only around 50 to 60%.
Only half the time, wow.
Yeah. And when you exclude the more obvious cases like, say, twinning or a clear EHV1 infection, the success rate for finding a specific cause for the remaining abortions can drop even lower. It can be frustrating.
So, given that difficulty, what's the absolute most important step someone should take when an abortion occurs on their farm?
The single most important thing you can do, according to all the expert sources, is to carefully collect and submit the entire fetoplacental unit.
Meaning the fetus and all the membranes.
Yes, the fetus and the entire placenta to a qualified veterinary diagnostic laboratory as quickly as possible. This is where the vast majority of the potential clues are going to be found. Don't just bury it.
Okay, so get it all to the lab. What specific samples are most helpful for them?
The ideal submission is the whole fetus and the whole placenta, kept fresh and chilled refrigerated but not frozen. Freezing creates ice crystals that can damage the tissues and make microscopic examination really difficult.
How should the placenta be handled?
It's really helpful if the placenta can be laid out carefully, maybe in an F shape, so the lab can examine its structure properly, looking for completeness and abnormalities. They'll take specific sections for testing. Besides the fetus and placenta, samples from the mare can also be useful.
Like what from the mare?
Blood samples, maybe paired serum samples taken a few weeks apart, can help rule out certain infectious diseases. Vaginal swabs taken soon after the abortion might be useful, though contamination is common. If you suspect something like leptospirosis, urine might be tested. And crucially, if you suspect fescue toxicity.
Send the hay or grass.
Yes, sending samples of the mare's pasture grass or the hay she was eating is absolutely essential for testing for the endophyte and the ergot alkaloids.
Okay. And what kind of tests are they actually running in the lab on these samples? What are they looking for?
The cornerstone of the investigation is usually a detailed gross pathology exam that's looking at the fetus and placenta with the naked eye, followed by histopathology, which is examining specially prepared thin slices of tissue under a microscope.
Like an autopsy for the fetus?
Essentially, yes.
Yeah.
A necropsy. They look for visible abnormalities in the fetus, like congenital defects or evidence of cord torsion characteristic twists, maybe hemorrhage or strictures in the cord. They examine the placenta very carefully for things like the two distinct placentas and villus contact areas you see with twins, or signs of villus atrophy suggesting poor uterine health, or the characteristic placental edema seen with fescue toxicity, or the appearance of a prematurely separated red bag. Histopathology helps rule out infectious agents like bacteria or viruses and can identify characteristic non-infectious changes in the tissues.
What about other specialized tests?
If they suspect a genetic issue, maybe based on fetal anomalies or a history of repeated early losses with no other cause found, they might perform cytogenetics, which is actually looking at the structure and number of the fetus's chromosomes. Toxicology testing is obviously key if specific toxins are suspected, like testing forage or mare samples for ergot alkaloids from fescue, or maybe other plant or mycotoxins if there's a reason to suspect them.
And tests back on the mare herself.
Beyond the initial blood tests, they might run specific hormonal assays. Prolactin levels can be depressed in fescue toxicity. Testing thyroid hormones is sometimes done, though its significance in abortion is a bit controversial. Testing the mare for PPID, or MSR, might be recommended based on her history or clinical signs.
What about looking at her uterus later?
Definitely. Follow-up tests on the mare's reproductive tract later on, when she's recovered from the abortion, are often very valuable. An endometrial biopsy is key to check for chronic inflammation, or that fibrosis, the scarring we talked about. Maybe a hysteroscopy to look inside the uterus with a camera for things like cysts or adhesions. Ultrasound of the mare during a subsequent pregnancy can also be a diagnostic and monitoring tool, looking at fetal viability, heart rate, and assessing placental health, sometimes using specific measurements like the combined thickness of the uterus and placenta, the CTUP.
Okay. It sounds like a really comprehensive but sometimes frustrating process to try and pinpoint the exact cause. Once you have a diagnosis, or maybe even if you don't get a definitive one, what can actually be done? How do you manage the situation and, more importantly, try to prevent it from happening again?
Right. Management right after an abortion mainly involves making sure the mare recovers well physically. But the real focus, absolutely, is on prevention for the future. And that prevention strategy is ideally based on the specific diagnosis, if you got one.
Or if not.
Or, if a specific diagnosis wasn't reached, you might focus on preventing the most common causes, like implementing strategies against twinning or fescue exposure, for example.
Okay, so first steps right after an abortion occurs. What should happen on the farm?
First, isolate the mare and, importantly, the fetal placental unit. Remember, you need to protect those samples for the lab. Then have your veterinarian examine the mare as soon as possible. They'll check to make sure she's passed all the placental membranes, because retained membranes can cause serious problems like metritis. They might recommend flushing the uterus, maybe with saline. And I know I sound like a broken record, but get those samples submitted properly.
Okay, sample submitted. Now let's talk prevention. If we know the cause was twinning, what's the approach?
For twinning, prevention is absolutely paramount. It's much, much easier and safer to deal with twins early than to manage a mare aborting twins late term. The most effective strategy by far is early and accurate pregnancy diagnosis using ultrasound. Scanning mares routinely around 14 to 16 days after ovulation allows your vet to identify twin conceptuses when they are still very small, usually mobile within the uterus, and before they fixate.
And what can be done then?
At that very early stage, the most common technique is manual reduction or crushing of one of the embryonic vesicles. An experienced vet does this transrectally via ultrasound guidance. If done correctly before about day 30, the mare usually just reabsorbs the remnants of the crushed conceptus, and the remaining singleton pregnancy can proceed normally with a high success rate. There are other techniques described for reducing twins later in gestation, but they generally carry higher risks to the mare and the remaining fetus.
Okay, so early checks are key for twins. What about umbilical cord torsion? You said that's hard to predict. Can you prevent that?
Unfortunately, based on the current knowledge in the sources, there's no specific known prevention strategy for umbilical cord torsion. We don't really know why some fetuses develop excessively long cords or tend to twist them more. And there's no way to treat it once it's developing during the pregnancy. Monitoring specifically for cord issues via ultrasound throughout gestation is also quite difficult.
So that one's tough luck, basically.
Pretty much at this stage.
Fescue toxicity, though, that sounds much more preventable.
Absolutely. Prevention is quite straightforward, conceptually. The best approach is to remove pregnant mares from any known endophyte-infected fescue pastures, especially during the last 60 to 90 days of gestation when the risks are highest.
What if you don't know if your pasture is infected?
You can get your pasture grass or your hay tested for the endophyte fungus and the ergot alkaloid levels. If you have infected hay, you can try diluting it by feeding it along with other non-infected hay types, or ideally, just don't feed infected hay to mares in late gestation.
Is there anything else you can do if avoiding it isn't possible?
Yes, there's a highly effective management tool available if mares must graze infected fescue for some reason, or sometimes used prophylactically. That's administering a dopamine antagonist drug, the most common one being domperidone. It's typically given daily, orally, starting about 30 days before the expected foaling date.
And that helps how?
It counteracts the prolactin-suppressing effects of the ergot alkaloids. This helps promote normal mammary development, ensures milk production, and generally helps the mare prepare for a more normal foaling, reducing the risk of those fescue-related complications like agalaxia and dysmature foals.
Okay. And for the red bag emergency, prevention seems tricky if it's often random.
Preventing it is difficult. As you said, it's often idiopathic, meaning we don't know the exact underlying cause in many cases. Sometimes it might be linked to underlying placentitis or maybe fescue exposure. But the crucial action, really, is managing the emergency when it happens.
Right, the immediate intervention.
Exactly. As we stressed, someone needs to immediately rupture that presenting red membrane and assist in delivering the foal as quickly as possible. That action saves the foal's life by allowing it to breathe. And it's critical to remember that foals born following a red bag delivery are often oxygen deprived and need immediate intensive neonatal veterinary care.
What about managing that general placental insufficiency, maybe linked to uterine scarring or cysts?
If it's linked to known chronic uterine issues like fibrosis or large cysts, the best prevention is actually addressing those problems before the mare is even bred again. This might involve treatments for endometritis or maybe hysteroscopic removal of cysts. Beyond that, optimizing the mare's overall health and nutrition throughout pregnancy is always important.
Can you monitor for it during pregnancy?
In mares considered high risk, perhaps due to age or a history of problems, monitoring placental thickness, using that CTUP measurement with ultrasound in late gestation can sometimes help identify potential problems early. However, the effectiveness of specific treatments aimed at supporting placental function during pregnancy, like progesterone supplementation or anti-inflammatories, is still somewhat debated and depends heavily on the specific situation.
Fetal abnormalities, anything to be done there?
Not during the pregnancy itself, unfortunately. If a specific genetic cause is identified or strongly suspected based on the aborted fetus, then genetic screening of the mare and stallion might be considered for future breeding decisions to avoid repeating the pairing if it's a heritable condition. But there's no treatment for the affected fetus.
And if the abortion was due to the mare getting really sick with something non-infectious, like severe colic?
Well, prevention there focuses on ensuring the mare is in optimal health before being bred, and managing any underlying conditions she might have. And then, if she unfortunately develops a severe non-infectious illness while pregnant, providing prompt, aggressive, and appropriate veterinary treatment for that illness is crucial to support both her and the pregnancy.
MRLS, the caterpillar issue prevention, sounds key there too.
Absolutely. Prevention is all about minimizing exposure. Keep pregnant mares away from areas known to have eastern tent caterpillar infestations, especially in the spring when the caterpillars are active. This might involve removing host trees, like wild cherry trees, from pastures or near fence lines, or temporarily fencing off affected areas.
Okay, so beyond these specific causes, are there overall general management and prevention practices that can help reduce the risk of non-infectious abortion across the board?
Yes, definitely. Several things contribute to overall reproductive success. Early and regular pregnancy monitoring with ultrasound is crucial. Catching twins early is the prime example, but regular checks also monitor fetal viability and can sometimes pick up placental issues.
And the mare's general care.
Foundational. Maintaining the mare's optimal body condition, ensuring she has balanced nutrition with appropriate vitamins and minerals, and providing a clean, safe, low-stress environment are all fundamentally important.
What else?
Knowing what's in your pasture and hay is vital. We talked about fescue, but testing hay can also identify other potential quality issues or toxins. Careful observation of your mares, particularly as they get close to foaling, is important. Sometimes subtle changes can be clues, although as we said, often there are none. Promptly involving your veterinarian if you have any concerns about a pregnant mare, or certainly if an abortion occurs, is critical. And being very careful and judicious with any medications administered during pregnancy, always checking with your vet about safety.
What about using drugs like progesterone, altranagist? You mentioned it's debated.
Yeah, altranagist, the oral synthetic progestin, Regulate being a common brand. It's sometimes used, but the sources really emphasize it's not a magic bullet or a cure-all for non-infectious abortions. Its primary indications where it might be helpful are generally considered to be cases of documented or suspected placentitis, usually later in gestation, say after 270 days, especially if the fetus is still viable. Or sometimes it's tried if there's a history of early embryonic loss that might be related to progesterone deficiency, although proving the deficiency can be tricky.
So, specific situations only.
Pretty much. Its efficacy really varies depending on the specific underlying cause of the potential loss. And it's important to remember it needs careful handling, wear gloves as it can be absorbed through human skin. There are injectable progesterone options too, but for many non-infectious causes, like twinning or cord torsion or fetal defects, progesterone therapy isn't going to help. Other medications might be used depending on the underlying maternal condition if that was the cause of the abortion.
Okay. After an abortion happens, what's the typical recovery process like for the mare herself? Does she need a lot of care?
Most mares, physically, recover quite quickly and uneventfully from the abortion itself, unless there were complications like retained placental membranes leading to infection or maybe trauma during the expulsion. They usually need limited specialized nursing care beyond just general monitoring of their appetite, attitude, and manure production.
Can they go back out?
Paddock exercise is generally fine and often encouraged to help with uterine involution, which is the uterus shrinking back down.
And the big question for breeders, what's the outlook for the mare's ability to carry a pregnancy successfully in the future after she's had a non-infectious abortion?
For the mare herself, the prognosis for future fertility is actually generally good, provided the cause of the abortion didn't cause permanent damage to her reproductive tract.
So things like twinning or cord torsion.
Exactly. Or fescue toxicity, once she's removed from the exposure. Those things don't usually leave lasting damage on the mare's uterus. However, if the abortion was perhaps secondary to a severe chronic underlying issue.
Like that uterine fibrosis, the scarring.
Precisely. Or maybe severe chronic placentitis that caused significant uterine damage. Those kinds of conditions can definitely impact her ability to establish and maintain future pregnancies successfully. The prognosis becomes more guarded then.
And what about the prognosis for the fetus itself in these situations?
Well, for the aborted fetus, sadly, the prognosis is obviously grave. It's deceased. For foals that are born alive but come from a compromised pregnancy like those surviving a red bag delivery, or born dismature due to severe fescue toxicity, their prognosis is often guarded to poor initially.
Why is that?
They are frequently born weak, underdeveloped, maybe suffering from the effects of oxygen deprivation, and they typically require very intensive, often expensive neonatal veterinary care in a specialized facility to have a decent chance of survival.
Right. So, wrapping this all up, what does this really tell us? This deep dive clearly shows that while we absolutely have to consider infectious diseases, this whole world of non-infectious equine abortion is incredibly diverse and complex, and honestly accounts for the majority of losses.
It really underscores that it's often not just about bad luck or some mysterious illness. The causes range from, the basic physics of the mare's uterus trying to accommodate twins to...
Yeah. It's clear that strategies like early detection, especially for twins, a really thorough diagnostic investigation whenever an abortion does occur, and implementing specific preventative measures tailored to these non-infectious risks. These are all absolutely key.
Couldn't agree more.
So this brings us to a final thought, something for you to maybe mull over. Given how many of these significant non-infectious factors are linked to the mare's underlying health or structural issues in her reproductive tract or environmental exposures, things that you can potentially influence with the right knowledge and actions. How much of improving equine reproductive success actually comes down to incredibly meticulous, proactive management and constant, careful observation rather than just reacting and trying to treat problems after they've already happened?